He thought he was infertile, but doctors discovered his wife had a hidden problem too. For 4 years, a young married couple dreamed about hearing one simple word. Mom, Dad. Every month, they hoped. Every month, they were disappointed. Friends announced pregnancies. Family members asked uncomfortable questions. Some even suggested, maybe you should just relax. Others blamed the wife. Some blamed the husband. But the truth was something nobody expected. Because this couple wasn't facing one fertility problem, they were facing two. Hidden, silent, and affecting both husband and wife at the same time. Doctors would soon uncover one of the rarest infertility combinations they had ever seen. The woman was only 31 years old. Her husband, 34. They had been trying to conceive naturally for 4 long years. No contraception, regular intercourse. Yet, not a single pregnancy. Doctors call this primary infertility. Let's break that down. Primary means the first. Infertility means the inability to achieve pregnancy after 12 months or more of regular, unprotected sexual intercourse. In simple words, the couple had never been able to become pregnant. Not even once. Like many couples, they initially hoped time would solve everything. Months became years. The emotional burden grew heavier. Infertility isn't only physical. It affects marriages, families, confidence, mental health. And for many couples, the unanswered question becomes unbearable. Why can't we have a baby? Eventually, they decided enough was enough. They visited an infertility clinic. Doctors didn't begin by blaming either partner. Because one of the biggest misconceptions about infertility is this: many people assume infertility is always the woman's problem. That simply isn't true. Worldwide, male factors contribute to infertility in many couples, female factors contribute in many others, and sometimes both partners have contributing conditions. This couple would soon discover they belonged to that last group. Doctors began with a complete evaluation: medical history, physical examination, laboratory tests, and one investigation every fertility clinic routinely performs: a semen analysis. What exactly is that? A semen analysis is a laboratory examination of a man's ejaculate. Doctors look at several important features: how much semen is produced, how many sperm are present, how well those sperm swim, and whether the sperm have a normal shape. Think of it as a complete health check for sperm. The laboratory technicians noticed something unusual. Very unusual. The semen sample contained urine. That immediately raised suspicion, because urine should never be mixed with semen during ejaculation. Then they noticed something else. Many of the sperm were dead. The sperm count was also extremely low. Repeated testing over several weeks showed almost no improvement. Doctors now suspected a condition most people have never heard of: retrograde ejaculation. Let's break that complicated name down. Retro means backward. Grade means direction. Ejaculation is the release of semen during orgasm. Normally, during ejaculation, the bladder closes tightly. This forces semen forward, out through the penis. But in retrograde ejaculation, the bladder doesn't close properly. Instead of moving forward, much of the semen travels backward, into the bladder. Imagine trying to water your garden. You turn on the hose. But instead of flowing out through the nozzle, most of the water flows backward into the house. That's essentially what happens. The sperm are produced, but they travel in the wrong direction. Instead of leaving the body, they end up mixing with urine inside the bladder. The husband had never realized this. He assumed everything was normal. Because retrograde ejaculation often causes little or no pain, many men don't discover it until they begin investigating infertility. So what causes retrograde ejaculation? Several medical conditions can interfere with the nerves and muscles controlling ejaculation. Diabetes, certain medications, previous prostate or bladder surgery, neurological disorders, spinal cord injuries, and sometimes congenital abnormalities. In other words, the body still produces sperm, but the normal pathway is disrupted. Fortunately, this condition is uncommon and accounts for only a small percentage of infertility cases. At this point, many people might think, mystery solved. The husband's condition explained everything. Or did it? Doctors weren't convinced, because fertility is always a couple's journey, not an individual one. So they continued evaluating the wife. And what they discovered next changed everything. Doctors continued evaluating the wife. She was 31 years old, otherwise healthy. She had never undergone pelvic surgery. She had no history of endometriosis. She had never been pregnant before. But there was one clue. Her menstrual periods were irregular. Irregular periods don't always mean infertility, but they can sometimes signal that something isn't working normally inside the reproductive system. Doctors decided to investigate further. The first test was a transvaginal ultrasound. Let's break that down. Trans means through. Vaginal refers to the vagina. Ultrasound uses harmless sound waves to create pictures of organs inside the body. Unlike an abdominal ultrasound, a small probe is gently placed inside the vagina to produce a much clearer image of the uterus and ovaries. The scan looked reassuring. There were no major structural abnormalities, but the doctors weren't satisfied. Sometimes, the biggest problems cannot be seen on a routine ultrasound. Next, they measured several hormones. One was called anti-Müllerian hormone, or AMH. What is AMH? Think of the ovaries as a bank. Every woman is born with a limited number of eggs. AMH gives doctors an idea of how many eggs remain in that bank. It doesn't guarantee pregnancy, but it helps estimate a woman's ovarian reserve. Her AMH level suggested she still had a reasonable ovarian reserve. Doctors also checked follicle-stimulating hormone, commonly called FSH. The name sounds complicated. Let's simplify it. A follicle is a tiny, fluid-filled sac inside the ovary that contains an immature egg. FSH is the hormone that tells those follicles to grow. You can think of FSH as the body's egg development messenger. They also measured luteinizing hormone, or LH. LH gives the final signal that releases a mature egg from the ovary. Without proper coordination between FSH and LH, pregnancy becomes much more difficult. Her hormone levels did not point to a major hormonal cause of infertility, so doctors looked elsewhere. Then came one of the most important investigations, a test called hysterosalpingography. Thankfully, doctors shorten it to HSG. Let's break it down. Hystero refers to the uterus. Salpingo refers to the fallopian tubes. Graphy means imaging. In simple terms, HSG is a special X-ray test where dye is gently injected into the uterus. If the fallopian tubes are open, the dye flows freely into the abdominal cavity. If the dye suddenly stops, it usually means there is a blockage. The result came back. Both tubes were blocked. Not one. Both. Doctors call this bilateral tubal blockage. Bilateral means both sides. Tubal refers to the fallopian tubes. Blockage means something is preventing passage through the tubes. Why is that such a big problem? Because fertilization usually happens inside the fallopian tubes. Let's imagine the journey. Every month, an ovary releases an egg. The fallopian tube gently picks up that egg. At the same time, millions of sperm begin swimming upward from the cervix. If everything goes well, one sperm meets one egg inside the fallopian tube. That moment creates new life. But if the tube is blocked, the sperm and egg never meet. It's like closing both ends of a bridge. No matter how many cars try to cross, none can reach the other side. Doctors identified the blockage near the cornua. What exactly is the cornua? The word cornua simply refers to the upper corners of the uterus. These are the points where each fallopian tube connects to the uterus. When that narrow opening becomes blocked, it's called a cornual block. Imagine placing a cork in the neck of a bottle. Everything behind it remains intact, but nothing can pass through. That's what happened here. The sperm couldn't reach the egg. And the egg couldn't travel normally either. At this point, the mystery became even more astonishing. The husband had retrograde ejaculation. The wife had blocked fallopian tubes. Either condition alone could have caused infertility. But this couple had both. Completely independent problems, working together to prevent pregnancy. No wonder 4 years had passed without success. Doctors recommended another procedure, laparoscopy. Let's simplify that. Laparo refers to the abdomen. Scopi means looking inside. Instead of making a large surgical cut, surgeons make tiny openings in the abdomen. A small camera is inserted. This allows doctors to see the reproductive organs directly. Not only can they diagnose problems, they can often treat them during the same operation. During surgery, doctors manage to clear most of the blockage, approximately 80%. But some blockage still remained. That meant natural conception was still unlikely. Before we continue, if you're enjoying these real medical mysteries explained in simple language, please subscribe to Health Casefile. Every week we turn real medical cases into powerful health stories that could one day help you recognize a life-changing symptom, or even save someone's life. Now, back to the case. Doctors realized this couple would probably need advanced fertility treatment. Not because one partner had infertility, but because both partners did. The next steps would involve some of the most remarkable technologies in modern reproductive medicine. Technologies that have helped millions of couples around the world become parents. But would they work for this couple? The answer would depend on procedures most people have never even heard of. Doctors knew they had reached a crossroads. Natural conception was now extremely unlikely, not because the couple lacked hope, but because biology had placed two major obstacles in their path. The husband's sperm could not travel normally. The wife's fallopian tubes could not allow sperm and egg to meet. If they wanted a child, they would need modern reproductive medicine. The first procedure doctors recommended was called TESA. That stands for testicular sperm aspiration. Let's simplify it. Testicular refers to the testicles where sperm are produced. Sperm is the male reproductive cell. Aspiration simply means using a fine needle to gently remove fluid or tissue. Instead of collecting sperm from semen, doctors inserted a small needle directly into the testicle to retrieve healthy sperm. The procedure was performed under local anesthesia, meaning only the area being treated was numbed while the patient remained awake. When the tissue reached the laboratory, embryologists carefully examined it under a microscope. And finally, they found living sperm. The husband's body was still producing sperm. The problem was never sperm production. The problem was getting those sperm out of the body normally. Now attention turned to the wife. Doctors scheduled oocyte retrieval. Oocyte is simply the medical word for an egg. Think of it as an egg that is mature enough to be fertilized. Before retrieval, the ovaries were stimulated with carefully monitored fertility medications. The goal was to help several eggs mature at the same time. Instead of releasing only one egg naturally, the ovaries produced multiple mature eggs. Using ultrasound guidance, doctors gently collected 4 eggs. Each represented another chance to create new life. But another challenge remained. Normally, millions of sperm compete to fertilize a single egg. That wasn't possible here. So doctors used one of the most remarkable techniques in modern fertility medicine: intracytoplasmic sperm injection. Thankfully, doctors shorten it to ICSI. Let's break that down. Intro means inside. Cyto refers to the cell. Plasmic refers to the fluid inside the cell. Injection means exactly what it sounds like. Instead of allowing sperm to swim naturally toward the egg, a single healthy sperm is carefully selected. Then, using an extremely fine microscopic needle, that one sperm is injected directly into the egg. Imagine trying to unlock a door. Normally, millions of people search for the correct key. With ICSI, the doctor already has the right key and carefully places it directly into the lock. It is one of the most successful fertility techniques available for severe male factor infertility. The fertilized eggs were carefully monitored inside the laboratory. Over the next several days, some developed into healthy embryos. An embryo is the earliest stage of a developing baby after fertilization. Doctors selected the healthiest embryo. Then came another important step: embryo transfer. This is exactly what it sounds like. The embryo is gently placed inside the uterus using a thin catheter. No major surgery, no large incision, just careful placement, followed by hope. The journey still wasn't over. The mother received estrogen and progesterone. Let's simplify those. Estrogen helps prepare the lining of the uterus. Progesterone helps maintain that lining so the embryo can successfully implant and continue developing. Think of the uterus as fertile soil. These hormones help prepare the ground so the tiny embryo can grow. Now, there was nothing left to do, except wait. Those next 2 weeks probably felt longer than the previous 4 years. Every phone call, every symptom, every moment filled with hope and fear. Then finally, the day arrived. Doctors ordered a VHCG blood test. That sounds intimidating, but it's actually very simple. VHCG is a hormone produced shortly after an embryo successfully implants inside the uterus. If the hormone is present, it usually means pregnancy has begun. The results came back positive. The hormone level was over 1,000. The embryo had successfully implanted. For the first time in 4 years, they weren't just hoping anymore. They were expecting a baby. This remarkable case teaches us something many people don't realize. Infertility is not a woman's problem, nor is it only a man's problem. It is a medical condition that may involve either partner or both. In this case, both husband and wife unknowingly had separate conditions contributing to infertility. Yet with modern medicine, their dream of becoming parents became possible. So, can infertility always be prevented? Not always. But many risk factors can be reduced. Maintain a healthy weight. Exercise regularly. Stop smoking. Limit alcohol consumption. Avoid recreational drugs. Treat sexually transmitted infections promptly. Manage chronic diseases like diabetes. Avoid unnecessary exposure to toxins. Seek medical evaluation if pregnancy has not occurred after 1 year of regular, unprotected intercourse, or after 6 months if the woman is 35 years or older. Most importantly, don't blame each other. Infertility is a medical condition, not a personal failure. If you're struggling to conceive, remember this story. For 4 years, this couple believed their dream might never come true. Yet the answer wasn't giving up. It was finding the right diagnosis. Because sometimes, the biggest obstacle isn't infertility itself. It's not knowing the real cause. Medicine continues to advance every year. And for millions of couples, hope is stronger today than ever before. If today's story taught you something new, please subscribe to Health Casefile. Every symptom tells a story. Every disease leaves clues. And every medical mystery we solve brings us one step closer to saving lives through knowledge. Because the next story could change the way you understand your own health. Thank you for watching. Disclaimer: this video is for educational and health awareness purposes only. It should not be used as medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional regarding fertility or any other medical concerns.